Hi everybody, my name is Martha Sullivan. I'm coming to you from Virginia Tech and I'm a professor of practice in industrial design.
Hello, my name is Jonas Nyasolo. I'm from Malawi University of Science and Technology. That's in Malawi. Thank you.
Hello, my name is Paris Mbeya and I'm from Malawi University of Science and Technology. I'm a student there doing IKSP.
Today we're here to talk to you about a partnership that we've formed between Virginia Tech and the Malawi University of Science and Technology. We work across a few different topics, and this partnership has been going on for 3 or 4 years, but the last year and a half, our teams have been working really closely. So I'm here representing TEAM Malawi, which stands for Technology, Education, and Advocacy Medicine in Malawi. And what we focus on is screening, diagnosis, treatment, and prevention of disease. So this is just kind of representing some of the projects that we're working on. Raman Spectra is a way to shine light through a liquid, and based on what comes back to you tells you what disease state you might have. Diagnosis, we're working on focused ultrasound, which uses bubbles to ablate tumors so that you can actually withdraw them through a needle, never undergo surgery. And so that's used to diagnose the type of cancer you have. But you can also use that technology. Here, this is an image of it treating breast cancer, and right now we're in clinical trials for liver cancer and headed towards cervical cancer. And what we're going to talk about today is prevention. And although I've listed here an HPV vaccine because we're interested in cervical cancer, you'll see we've hit prevention in kind of a new way.
So, Indigenous Systems and Practices under Bingo School of Culture and Heritage, that is BISC, and the MAST, that is Malawi University of Science and Technology. So, what is Indigenous System? This is a program which was introduced by MAST, that is to engage more into indigenous knowledge, to know the people. And we learn about that is culture, heritage, and mostly what we are here for, that is us in drawing and painting, and also graphic designing. So that's more what we do on indigenous systems and practices.
So almost 2 years ago, our team traveled to Malawi. MUST is in the southern part of Malawi. The largest center around it is Blantyre. We were working in a regional district called the Thyolo District, and specifically the Thyolo District Hospital. This is my cancer treatment team, and so right now we're looking into what would be their cervical cancer screening room. And this is the waiting room where women are on their intake. And so a group of women will come in and the nurse will explain what's going to happen to them and what kind of results they're going to get. And this is the information that they can see in that space. It's 2 little sheets. It has a number of pictures on it. She holds up another one that's about this big that's showing you what is your cervix, what does it look like to have a lesion, what does it look like to have cancer, what kind of procedure you're going to go under. So as a designer, I see a lot of opportunities in this space for our whole team. On that same trip, we also did a lot of work in the community. So there's women in Malawi who walk 2, 5, 10 hours to a single appointment. And so the healthcare that they're receiving is very different than even at the district hospitals. And so we spent time with colleagues from the Bingo School who helped us with the language barrier, interviewing women about what their knowledge of cervical cancer was. And in that, we learned that they had a lot of questions about women's health and not just cervical cancer. So my specialty here is design research, is encouraging people to do contextual research. I took a design student with me, and we knew, because we're doing an educational program, to look at the visual communication that was happening on the ground. And so we were documenting what we were seeing in the hospitals. So this is like a hygiene sign. This would have been in a state hospital, publicly funded. And this, we found this beautiful mural of Africa's taller than me inside of Mercy James, which is a private hospital, mostly funded by Madonna's Foundation, but there's probably 25 other foundations that are there. So we got really, I don't know, I'm a design nerd. I got really excited about this, and I was trying to learn how could we set up an educational program for some of the things that we were doing. while at Thyolo District Hospital, I noticed they were using murals too. And it really sparked an interest in, if we have money to have a positive intervention in the cervical cancer treatment space, maybe we could do murals as well. And I reached out to the hospital about that, and not knowing me, they were like, yeah, no, I'm not so sure. But they did say, well, if you're interested in this, then you should help us with the murals that we already have, because they're 20 years old, they're illegible, they're deteriorating, people can't read them anymore, and maybe that's what you could do for us. At that same time, I was thinking back to these guys. I actually met their Indigenous Knowledge Systems and Practices class as first-year students through ceramics, and in talking with their dean, when I was saying, how can I get involved with your school? I love art, I love design. Like, what can I do in this space with you? And they really reached out to me about professional development, about opportunities for their students, of course, materials. And so at first when I was like, oh yeah, we'll do a mural thing, I'll bring Virginia Tech students, we'll design it, they'll learn about culture, and we'll just knock it out. And then I was like, okay, it's not about me. When the dean asked me to help, she really wanted her students to have more opportunities, and that's where Virginia Tech and Must are like shoulder to shoulder. We both believed in experiential learning as an opportunity to advance people not only in what they love, but in their profession. And so instead of establishing a mural project with my students, I tried to work with the Malawi University of Science and Technology and establish a mural program with their students. So that's what we set out to do, and I loved the talk yesterday. Added this one since then. I tried to think about all the different things that the project was touching, because design, I'm a more is more kind of person. And so we had one goal of protecting women, bettering their health, improving healthcare. And then the second goal is the students. What kind of student experience can I have? Because I believe that activism is a fundamental part of design, and that's not necessarily natural for everyone. You have to practice it a couple of times. Practice it someplace where it's safe. It gets a little bit easier to do when it's hard. So pretty excited about how we're addressing health, education, gender, job growth, reduced inequities, especially in healthcare, and then trying to establish best practices for partnerships across the globe. So the way this project kicked off was first by making a really good connection with a teacher there, Mr. Ngwale. We applied for him to come to the United States for a fellowship for a National Council of Education and Ceramic Arts, and then he came to Virginia Tech for a week. And this is an example of my friend Chris, who teaches screen printing, teaching him how to make a screen and pull it, because that's a machine that Malawi University of Science and Technology had just recently bought. And so we were trying to do a little bit of teacher training. He teaches graphics. I wanted to see that output, because graphics, signage, printmaking, that's a job opportunity in the future for someone. When he went back to school, his job was to focus on these kids and running through the history, theory, and mechanical techniques of art. So at the time they were in a drawing and painting class. And so this is just a chance when I got to visit and really solidify the partnership. It was so fun to visit them in class and see the work that they were doing. As a teacher, the other thing I knew that was important for professional practice is all the documentation that's necessary for designers, whether or not that's in the front end or the back end. And so we worked with the students digitally across borders to have them write the proposal to the hospital. It wasn't going to be me showing back up in that hospital, it was going to be the students. And so they worked together to write out the who, what, when, where, why, and how, which I laid out as a fundamental to doing any design proposal that they might want to try in the future. They took that proposal back to the hospital, and they were the ones to present it to the hospital. This is what we want to do, this is how we're going to execute it, this is the time frame, can we? And the hospital was really excited and said yes right away. And so we did our best to remove barriers to make sure that they could do that. From my standpoint, as the organizer, or the sort of the passion behind this, strung together about 8 different grants to make this work. At different portions, whether or not that's me getting there, materials, them going somewhere, them coming here, all of those things. So it's a pretty big commitment, but 100% worth it. So we looked at painting supplies, transportation for them to get from the school to the hospital, and then lunch for those days. All of that kind of working in the background so that when they went, they could be the most successful. So I'm going to pass it over to Jonas, and he's going to talk a little bit about their on-the-ground experience.
Thanks very much. My name is Jonas. I hope you can see me there in the picture. Our project was divided into 2 phases. We had phase 1 and also had phase 2. Now, during phase 1, what we did mostly was to go there and study the murals and see how these murals were designed and how they were done, so that we should make sure that we produce the work that is nice. First of all, we sat down as a team of students and made an arrangement to say we need to work as a team, because it's only when you work as a team that you can achieve a great success. Also, what we wanted to do was, if you can see, these are the previous ones which were done a long time ago. So what we're trying to do was to normalize the style and make sure that there's consistency in the way the murals we are looking. So these are 10 successful steps for breastfeeding. Another one was we're also looking at color theory. On color theory, what we did was we need to sit down and make sure that we bring in appropriate colors to make sure that the colors that we use are appropriate for the walls, as well as the material that we are using, so that we should bring out the work that is very commendable to the people, that people should look at the work and appreciate it. So color mixing was also an important component of this project. Also, when we went there, we noticed that some surfaces were uneven, others were rough. So before engaging on a mural, what you need to do is you need to study the surface on which you are going to paint the mural, so that you can decide which material to use or not to use. And also, if you look at this one, this is much larger than the ones we did before. So we also took our time to work on the mural on a larger surface. So this had the name Thyolo District Hospital, as you can see there. It also had other murals within the wall. And also, this was the first phase, and during the end of the first phase, that there is one of the officials from the hospital. He was telling us how the hospital is pleased with the work that we did, as well as the patients also appreciated our work. From phase 1, I will now go to phase 2. During phase 2, what happened was, after having a learning experience from phase 1, so what we did is we learned a lot from phase 1. It was more of a learning process. But when it came to phase 2, we did a lot of work whereby our confidence was increased because we knew what we were doing. And also, during phase 2, there was also, in terms of time management, we worked faster to achieve our goal. And also, there was easy implementation of materials and process. We had studied our materials, that is in according to what the walls were designed at hospitals. So in terms of time, we did achieve time management a bit more effective. At the end of phase 1 as well as phase 2, we went back at the hospital. That was in October, to go there and see how our work is looking up there, and also to try kind of review and see what other work in future can we do for the hospital. At this point, let me pass to my friend Precious to continue. Thank you.
All right, so the question might be, why Murals? Why Murals? How does Murals connected to good health? So that might be a question. So to step back, Malawi is one of the poorest countries in Southern Africa. That is surrounded by 3 countries. It's a landlocked country. It's surrounded by Mozambique, Tanzania, and Zambia. So there is also a high illiteracy rate in Malawi because of the education system. It's not that good, and because of the status of our economy, as we are poor. And there's also people are not aware, like when it comes to women, they are not aware of the good weather when it comes to good health. So we thought the Murals could help them in many ways, as it's an universal language, so people might understand it better when they see than read, because a lot of people don't know how to read. So when you put words right there, it'd be useless. But when you put Murals, and the understanding of it might be different when it comes to words. So first is yes, understanding. And I was really happy that time when I was painting Murals, when some of the women were crossing by, and then when they saw Murals, they understood what was going on in the mural. Like, for example, here, the mother is breastfeeding the baby. So they understood what was going on without reading the words, as they don't know how to read. So they just understood by just looking at the picture. So that was really helpful for them. And also we have encouraged the behavior changes. As a lot of people came to the hospital, they were attracted by the artistic work of the Murals, and they had discussion. They had a healthy discussion about the Murals. Without the Murals, they couldn't have that discussion. So because of the Murals, they had that discussion. And memory retention. This is when you see something, it's easier for you to remember than to read. So it helps them to remember what was going on in their, when it comes to healthy messages, it helps them to remember. And we have emotional engagement. The Murals have emotional effect on the people when it comes to, like, for example, here, we can see the love of the mother towards the baby. So it triggers deep emotions. So it's not easy for people to forget what they saw on the message of the health. And also we have cultural relevance. In Malawi we have many cultures, and to avoid exclusion, we ask people and do a little research on how we can present our work, because the way we can put in South is not the same way we can put it at the North because of the cultural differences. And also we have community building. Community building, this helps as people have many discussion about the health. When they see Murals, they have a discussion about it, they talk about it, than when you put it in words, because they cannot understand. When you put Murals, they understand what's going on and they have a conversation about it. And also we have reduced stigma. I would take example of my family. In our family is patriotic, and always when it comes to baby care, is for the mother. It's only the work of the mother. The father is not involved. So Murals will help people to understand that it's also responsibility of the father to take care of the child. So they can be a good health when it comes to a mother and baby care. I'll leave you to Professor Mark.
So the team worked over 6 days. The first round, they did 4 murals in 3 days, and the second round they did 13 murals, the same group of people. So the evidence that they were getting better was real, but as a teacher, I knew I needed to do some assessment. So we did qualitative analysis with the hospital, and I did quantitative analysis with the students to see if they were doing well. They were excited about what they started with, like the communication, teamwork, but they were not they didn't feel, there were some that are gonna do more of the community building as opposed to the art side of Indigenous knowledge, and so they were okay with the professional practice, and they were still in Malawi, so they had not gotten a global perspective, but you can see where we've gone with that. And then digital literacy, because it was a painting project, we didn't have a chance to do that. But welcome to presentation land and technical writing. So we started with public speaking to our own group and to the Virginia Tech group. They applied to a conference in Malawi and did a presentation there, which was great because it really elevated their voice inside of a country where I want them to work. You know, I want them to have opportunities there. And we're gonna go forward with finishing some of the murals that weren't done at the hospital, training the next set of, mentoring the next set of students, the second year students, to do more graphic design. And then this is some of the students talking to Dr. Joe, who is one of the doctors bringing a technology device for cervical cancer screening. So how can we design new murals now that they know? I'm gonna do it just really quick before she ends me. We're working with radio and also with music to address this. The students want to try new locations. This is inside some hospitals right outside, schools right outside of their university. Some of the students want to go on to do the other types of art that are available, so we're looking at 3D printing ceramics and doing their second international exhibition in the United States. And we have one student who is figured out I can do good grant writing. Now he's learning how to write his own grants to support community-based childcare centers in his area, which are suffering quite heavily. So just finding meaning in our work. Jonas, you'll have to do it pretty quick.
Maybe you might be asking why Indigenous knowledge doing at the hospital. The thing is, Indigenous knowledge systems and practices is about learning about the culture of the people. You know, you understand the culture of the people, you understand their norms, you understand how they do their things. So what happens is, after doing this project, there was more increased impact in the communities whereby people were aware of the messages that was written in the murals. Another thing is the community also benefited a lot. As you know, messages bordering on health messages, bordering on health, do reach far when they are painted, instead of the hospital staff going to the village to spread the message. So there was an impact. And also, if you look at Indigenous knowledge systems, what it does is it bridges the gap between science and art. You know, we know that science does not occur in a vacuum. If you have a technology as a result of science, if you want that to impact the people, you need to understand the people, you need to understand their culture, you need to understand how they do their thing. So Indigenous knowledge and science, they need to come together and work together. So that's pretty much how impactful this project was. Thank you.
For the schools, we had a pretty strong lesson in deep listening. I know I did personally a couple times, just had to, again, remind myself that I'm there to learn and to start with a beginner's mindset. If I had not slowed down when they said no and listened to what they really need, we never would have gone forward with this project. And now I'm so grateful that they told us to practice, because practicing those large murals gave them the skills to do more, which is really wonderful. And I feel really lucky for these partnerships. I've learned from them. It's the joy that we have when we're together is so fun. And then it's so exciting to see them empowered and go back into Malawi and do amazing things. So this is some of the students from MUST that are now studying at Virginia Tech. And I just wanted to end by saying thank you, especially to my partners, who this work wouldn't be possible without. I'm so grateful to these students, and I'm grateful for opportunity to share this work.
Just to last it, I want to also thank the Virginia Tech for supporting us and bringing us a lot of donations to work, so we can progress and doing more murals and spread the information about the health. Thank you.